Well, given the economic situation, I really would like to talk about, let's call this one stretching your skincare dollar. Because I think a lot of us, many of us, are feeling like, okay, it's time to really look hard at our expenses and cut back where we can. And that might mean, buying slightly less expensive products. There's a lot of good information on our website, skintour.com, about that, about products. There are some areas in products where it really is worth it to spend the extra money, and others where it isn't. So what I want to talk about is how can you stretch your skincare dollar and be budget friendly at the same time. So I think as far as products go, a couple areas where you can really spend less money and do just fine, I think, are cleansers. For sure. I mean, like Cetaphil cleanser from the drugstore, great little cleanser, doesn't dry your skin, doesn't cost a lot of money. You don't really need anything fancy for that. Another area is moisturizers. You really don't need, in general, the $50 moisturizer. They're nice. They're cosmetically a little more elegant, Sometimes they smell better. Most of us have one that we just adore. We love it. If you can afford it, go for it. But you know what? The Cetaphil cream at the drugstore, again, I mean, there's a whole, Purpose makes a moisturizer, Basis makes one, Olay makes them. A lot of the drugstore brand moisturizers are quite good. Vanicream, which I adore for my patients with sensitive sensitive skin. It's called Vanicream, Vanicream, and it's made by a company called Free and Clear. That's a great moisturizer. You can get that online. I think, okay, you're saying, okay, that's nice, I've saved some money in my, here's the one area where I think you shouldn't save your money. You really want to buy the more expensive vitamin C's, because you know what, they're going to absorb and do what they're supposed to do way better than the cheap ones. In general, the creams are not very effective. I think in general you want to pay the money for the vitamin A, either in the form of prescription Renova or like Skin Medica's retinol complex is nice. SkinCeuticals makes a retinol 1.0, again, can be kind of irritating, but you need the better quality products. The ones where they're just throwing a tiny little bit of retinol into a product, you might as well not waste your money on it. So in those areas, I think when it actually comes to active treatment products, you're better off just buying one product and making it a good one than buying a bunch of cheap ones. So I think that's one thing to think about. And then I think, on the Botox front and the filler front, okay, so here's some ideas about that. So maybe instead of doing, like if you're doing your frown lines and your eye area, for crow's feet or here, maybe instead of doing both of those each time, maybe you alternate. Maybe one time you do your eye area and the next time you come in you do your frown lines. You can kind of stretch it that way. You can go down on the amount a little bit, but you just have to realize you may not like it because it won't last as long and you're not going to get the same effect. Sometimes I think it's almost better to do one area really well and then switch the areas off if your budget needs, if you need to be really budget conscious. And I think a lot of us do right now. So that's one way to kind of stretch it. Another idea I have is sometimes my patients will come in and they'll do their Botox and their filler at the same time. I think that's great. But maybe, if your budget's tight, you just do your filler every other time. Do your Botox and then when you come in, do it every other time instead of every time. And again, it won't be as good. You'll know that up front. Ask your doctor about changing to the higher molecular weight versions if you're using Restylane or Juvederm. Some patients that won't work, it'll be too full or lumpy in them, but many people, if you use those higher molecular weight ones, they will last a little longer. So try that too. And then I think, as far as lasers go, it's kind of tough because many people, depending on what your problems are, many people really do need full face laser, and it doesn't work to spot treat because then you end up with an area that looks different than the rest of your face, which you don't really want to go around looking with one area lighter in color or much better texture or whatever. So, but I do think there's some instances, like for example, if you're kind of red or you tend to have the blood vessels around your nose, you can just spot treat your nose and save some money that way. And then maybe, again, every other time do full face and then spot treat your nose on the alternate times and save yourself money that way. So I think there are some ways if you're trying to keep your skin great, but not what you want to do. You want to do the maintenance, absolutely. You want to keep your skin moving you know, even if you're not in repair mode, in other words, spending the time and money it takes to repair that sun damage, you can totally do maintenance mode and keep your skin looking nice. And then at a time when your budget, you know, loosens up a little bit, then you can go for some of those more expensive treatments that will actually do more in terms of repairing the sun damage that you've had, or the acne scarring, or whatever. So I'd say stick with your maintenance, and if your budget is tight, and then, you know, defer those more expensive lasers until later. So I hope that helps.